from a sedentary to a physically active societal way of life. This is Up on Our Feet.
Welcome to Up on Our Feet. As you've previously heard on Up on Our Feet, there's a good deal of research supporting the premise that physical activity can both effectively prevent and treat depression. However, when it comes to the impact of physical activity on anxiety, the limited number of studies conducted to date are conflicting and thus inconclusive. However, within the past year, a particular study was conducted and published looking at this very issue. And here to talk about physical activity and its impact on anxiety is the study's lead author. Associate Professor Dr. Maria Åberg is a senior lecturer and specialized physician in the School of Public Health and Community Medicine at the Institute of Medicine, Sahlgrenska Academy at the University of Gothenburg in Sweden. Dr. Åberg, it's nice to have you with us.
Thank you very much for the nice introduction. Also, thank you for the invitation and honor to be a member of the American Sports Institute International Board of Advisors. Right. I'm looking forward to that and to the interview now.
Okay, you are most welcome. Okay. All right. First question. What exactly is anxiety?
Well, I will answer this question as a physician. Symptoms of anxiety range from feelings of worry to the somatic symptoms of anxiety frequently found in panic disorders, including flushed skin, shortness of breath, tremors and sweating, pulse and blood pressure increase, and pupil dilation. These symptoms, known as the fight or flight system or threat circuit, are caused by increased sympathetic activation of the autonomic nervous system. In contrast to panic disorders, individuals with generalized anxiety disorders experience more of a constant worry and anxiety in several aspects and situations in their daily lives, and often have difficulties in coping and control their anxiety, which can lead to catastrophic thinking. Other symptoms are pain and sleeping disturbances that often can be misinterpreted for other somatic disorders. So much can be said about how we as physicians decide the anxiety diagnosis. Simply put, we have strict criteria to follow, such as time frames, a certain number of symptoms, exclusion criteria, and most importantly, disability. So, for example, the Diagnostic and Statistical Manual of Mental Disorders, which is called DSM. Now we have the 5th edition, which is used worldwide. Its definition of, for example, generalized anxiety disorders follows the diagnostic criteria that excessive worry occurring more days than not for leastwise 6 months. So finally, the question was, what exactly is anxiety? I would like to finish with some thoughts regarding how common it is and the consequences. So every third patient in the waiting room at the Swedish healthcare center is seeking help for common mental disorders, including anxiety. Anxiety are the most common of those, substantially reduce quality of life, and are the 8th leading cause of years lived with disability, associated with elevated risk of cardiovascular diseases, premature mortality. All this emphasizing the importance of finding effective treatment strategies that can be addressed in primary care. Yes, it was a long answer, but
well, that's okay. That's all right. So this leads me to a question. Why do people become anxious? What purpose does anxiety serve?
Yes, anxiousness is a normal reaction when exposed to stressful events or danger, but when it affects your daily life, and for example, your ability to work and function in the society, it becomes a disorder. Anxiety disorders are believed to be polygenic, and there is an interaction between genetic and numerous environmental factors. So environmental factors such as childhood abuse and neglect, fearful and stressful life events have been related to increased risk of anxiety disorders later in life. Most anxiety disorders have their onset in childhood or adolescence. Females have twice as high risk compared to males. So as said, regarding environmental factors, there are a number of negative life events that increase the risk. And that's, for example, financial difficulties, unemployment, physical illness, injuries, side effects of medicine, alcohol, and drugs. Any of these can make things simply too much, and anxiety takes hold.
Okay, so we usually think of anxiety as being a negative condition, as you just talked about. Does anxiety serve any positive purpose?
I believe the main reason people fail to deal with bad emotions, such as anxiety, is that they don't understand their purpose. Because anxiety, in fact, serves positive purposes. For example, if you meet a wild lion, I mean, it's appropriate to get anxious and try to escape. If you are in a working environment with a condition with high demands and very low control, it is also appropriate to feel anxiety and perhaps a signal to change job. So think of anxiety as a message that is telling you that you need to be more prepared. As soon as you look at it that way, you will be able to take advantage of it instead of thinking of it as a negative emotion. And now I talk about you and me, or sometimes, I mean, you get the disorder, but I think it's good to think about anxiety as also normal in circumstances that are hard. Yeah.
Okay, so does this mean then, from what you're saying, is the more what skills you might say, or the more talents or whatever it might be that a person has, the less likely they are to be anxious because they're able to deal with a particular situation that comes up and they can handle it? And if they don't feel they can handle it, they become anxious. Is that what happens?
Yes. Yes. Yeah. I mean, you have, if you are, I can say this like this: people in a position of anxiety. Now we're talking about the disorder. They are also, you and me. If you meet a lion, you are quite aware of what is happening. But people in the anxiety disorders are often unaware of what is happening to them. So many of them, they are fearing that they are gone insane, or that something is seriously wrong with them. So they are experiencing acute fear. You mean that the fight or flight system or freeze response procedures, as well as an array of symptoms that come with it. So it's complicated.
Right. Okay.
Yeah.
All right. So in the introduction, we talked about the study you've done in the past year regarding the impact of physical activity on anxiety. How does physical activity impact anxiety? What exactly happens?
There are several different mechanisms, and it takes a little while to sum it up, but I will try.
Take your time. All right.
Yeah, basically, exercise affects brain plasticity, which is the ability to change. Numerous of studies, both in human and non-human animal research, support that aerobic fitness training in particular, but also resistance exercise, both have positive effects of brain function and cognition throughout the lifespan. So several neurotrophic factors, molecular and cellular changes in the brain are induced by exercise and appear to underlie the effects of fitness on mental health. So in the brain, regular fitness training has been observed to enhance angiogenesis, synaptogenesis, neurogenesis.
And neurogenesis, if you would, would you define neurogenesis for us?
Yeah, that's new formation of nerve cells from stem cells. And I mentioned angiogenesis, that's new formation of blood vessels, and synaptogenesis is increased communication between nerve cells. So that's very exciting. Exercise also upregulates a number of neurotrophic factors in the brain, such as BDNF, VEGF, IGF-1. So BDNF, that's brain-derived neurotrophic factors, counteracts aging, inflammation, and oxidative stress. VEGF, vascular endothelial growth factor, and IGF-1, insulin-like growth factor 1, both stimulate angiogenesis. Exercise also increases serotonin noradrenergic synthesis and reduces levels of pro-inflammatory cytokines, increases levels of endorphins, and reduces response to stress by regulating the HPA axis. So yeah, it's a lot of pathways and neurotrophic factors that have beneficial effects on mental health. Other effects include normalization of cortisol responses to stress, improved sleep, both of which may be anxiety reducing. There are also psychological theories that propose that mental distraction and improved self-confidence can be part of that improvement. The social participation in an exercise group context could be therapeutic in itself. So yes, that's a summary. Yeah.
Okay. So, you talked about a number of factors here, just a whole host of ways in which physical activity positively impacts the brain and impacts anxiety. Is physical activity both a form of prevention as well as a treatment for anxiety?
Yeah, the short answer is yes. But I guess you will have a longer answer. So to start with prevention, physical activity and reduced sedentary behavior have a preventive effect on anxiety disorders. For example, we demonstrated in an article in Psychological Medicine in 2018, significant association between low cardiovascular fitness in adolescents and later risk of anxiety disorders. On the opposite, a high fitness was associated with lower risk. So that's an example of prevention. If we then proceed to treatment, meta-analysis of randomized controlled trials, so-called RCTs, studying anxiolytic effects of exercise suggests that exercise is an effective treatment on its own, as well as combined with other therapies. However, most of the intervention studies included in this meta-analysis are at high risk of bias. So high quality RCTs are needed to gain further understanding of the effects of exercise in treatment, and also to develop optimal exercise protocols. So therefore, we carried out a blinded RCT within the primary care context. And there were key gaps in the literature regarding how physical exercise may affect, for example, cognitive function, quality of life, and workability. So these were all issues that we addressed to inform the development of optimal exercise protocols. So we recruited 286 patients from primary care in Sweden. Participants were randomly assigned to one of two group exercise programs, one with moderate intensity and one with high intensity, with cardiorespiratory and resistance training. And we had one control with a standard treatment, non-exercise. So the 12-week guided exercise intervention for these patients was associated with the reduced symptoms of anxiety in both exercise intensity groups. So about half of the participants had lived with anxiety more than 10 years at baseline. So the results show that their anxiety symptoms were significantly alleviated, even when it was a chronic condition. So that was very exciting. And in addition, the quality of life was improved. We are currently analyzing the cognitive outcomes. An important finding is that visual-spatial ability improved in the high intensity group compared with controls. And that was at 12 weeks. The 1-year follow-up has recently been unblinded. So I'm happy to tell that at the 1-year follow-up, the anxiety and quality life scores in the intervention remained at the lower level reached at the 12-week. So taken together, is finding strengthen the view that supervised, individualized physical exercise represent an effective treatment and should be more frequently made available in clinical practice for persons with anxiety within primary care.
Okay, so yeah, that sounds very promising. So in this context of treating anxiety with physical activity, how does physical activity compare to other forms of treatment for anxiety, such as psychotherapy and prescriptive drugs?
That's very exciting. As a GP, I handle a lot of patients with anxiety in everyday work and practice, and I've seen a huge need of more treatment alternatives. So today's standard treatments for anxiety are cognitive behavioral therapy and pharmacological treatment. Despite notable pharmacological advances, treatment resistance, side effects, and poor medication adherence are very common among my patients with anxiety disorders. Long waiting lists, which is common for psychotherapy, may worsen symptoms and long-term prognosis. So in panic disorder, to start with, cognitive behavioral therapy or antidepressive treatment have actually significantly greater effect on anxiety symptoms compared to physical activity alone. However, studies suggest that adding physical activity to individuals with panic disorder, generalized anxiety disorder, or social phobia may have greater or longer-lasting effects on anxiety symptoms compared to CBT alone. In our RCT, we found that exercise had the greatest effect among those who were already on pharmacological treatment. Perhaps you know the SSRI, selective serotonin reuptake inhibitors. So they had, we believe it is due to a synergistic effect. So that's quite interesting. So I hope that we will have more specific guidelines in the future for treating anxiety disorders in combination, exercise in combination with psychotherapy and prescriptive drugs.
Okay. A while ago, you talked about, I think you said, regarding physical activity and anxiety, you mentioned both the aerobic types of physical activity and resistance types. maybe,
Mm.
cycling or weightlifting or something like this.
Mm.
Is there anything also then about the intensities of the type of aerobic activity or resistance training? Can people, could going for a brisk walk be considered a good enough type of physical activity to help in the treatment of anxiety? Is that possible?
From our study, we found that exercise, including both aerobic and resistance training for 12 weeks in a group program 3 times per week, 1 hour each time, that had clinical effects. So you ask about the intensities.
If people, in other words, there are some people, they may not be able to exercise excessively, but they can go for a daily walk or something.
Yeah, exactly. And our study actually supports that, since low to moderate intensity exercise benefits almost as much as high intensity exercise. Both groups went from a high level of anxiety at baseline to a low or mild level of anxiety after 12 weeks, measured with Beck's anxiety inventory scale. So, but I have to tell that measuring the clinical effects statistically, we can conclude there is a trend for more improvement the more intense you exercise. But it's important to start at your level.
Mm-hmm.
Yeah.
Okay. So if physical activity positively impacts anxiety, does this mean that people who are normally physically active in their everyday life are less likely to experience anxiety than less active people?
Yes. Regular physical activity and reduced sedentary behavior are associated with the reduced risk of developing or relapsing into anxiety symptoms. So a World Health Organization recommended dose of exercise for mental well-being in adults is that you should do at least 150 to 300 minutes of moderate intensity aerobic physical activity each week, but also do muscle strengthening activities at moderate or greater intensity. And you should limit the amount of time spent being sedentary, of course. Mm.
So in a sense, you're saying it's both if you want to prevent anxiety in a physically active way, it's both the aerobic and the resistance training combined that has the really strong positive effect.
Yeah, and that's very exciting because when you look at the recommendation for cardiovascular diseases, they state only the aerobic physical activity, but when you look at mental well-being, both are mentioned. Yeah.
Okay, so what's ahead regarding research on the effect of physical activity on anxiety? Where's all this going? What do you see happening in the future?
You mean the forthcoming studies?
Yeah, what's the potential for the effect of physical activity on anxiety in future studies and things like this?
I see. In my opinion, forthcoming studies should or could address the use of guided exercise in separate categories of anxiety disorders and also compare effects of exercise for acute and chronic conditions. But even now, we and others have shown an effect on clinical variables of anxiety by regular exercises. There's no doubt about it. However, research results have seldom been translated into clinical practice. So as anxiety disorders are most often treated in primary care, implementation research in this setting is essential. So therefore, clinical trials looking at implementation are needed. There are often complex processes of improving the adoption of evidence-based intervention into healthcare delivery system, which we need to look at. We need high-quality implementation studies in the future. So that's the most important thing, I believe.
Okay, so in this context, and we didn't talk about this earlier, we know that trying to get people to change their lifestyle is a very difficult thing. And if there's so much potential here for the positive impact of physical activity for people who have anxiety, is there anything you've come across or any research on how do you get people who are basically sedentary and anxious, how do you get them to change their lifestyle to become more physically active so that they're not only less anxious, they're healthier, and then they don't have to possibly do psychotherapy or prescriptive drugs or things like that? How do you get them, or do you even know, how do you get people who are not sedentary to be more sedentary so they can be healthier and less anxious?
I mean, that's a big question. I actually, when we recruited these 286 patients, I guess that's what we did. I mean, they have been suffering for over 10 years, half of them, and all were sedentary. So I think the key was that they met in a group. They had a supervisor. Actually, many of them became friends. They continued to exercise. So when you ask that question, I mean, I meet these people every day, and it's difficult, but I think we have to. I don't think they can do it alone. That's my answer. Yeah.
So there has to be some kind of social support structure and network is what you're talking about here. Yeah.
Exactly. Yeah.
Okay. All right. Final question. With the work you've done regarding physical activity and anxiety, and especially the particular study that we've been discussing, in the big picture of things, what's the big message, the big takeaway, the major conclusion you've come to?
Well, I have 3 conclusions. First, it was a rather short intervention, namely 12-week. That's not so long time. 12-week guided exercise within primary care was enough to reduce symptoms of anxiety. Second, moderate intensity exercise has almost as much benefit as high intensity. That's important. And third, the effects are long-lasting and not deteriorating at the 1 year of follow-up, which is very encouraging. So, yeah, I hope in the future it will be made available in the clinical practice for persons with anxiety disorders.
Okay, very interesting. Associate Professor Dr. Maria Åberg of the University of Gothenburg in Sweden, thanks for being with us on Up on Our Feet.
Thank you. I also would like to thank you for this pleasant interview, and I very much appreciate the invitation to conduct it.